Hey guys, it's Dr. Justin Marcagiani here. Really excited to chat with you all today. We got a live video for you as well as a fresh topic. Before we dive in, make sure you smash and hit that thumbs up and like button. Really helps the YouTube algorithm. Also today, we're going to be talking about low progesterone, infertility, and mood issues. If any of those issues ring a bell, please put your comments down below. Really want to know what you think. And then we'll open this up to a live Q&A. Not a lot of functional medicine docs do this. Really want to engage with you guys, want to know what you think and be able to have that good face-to-face interaction. If you also want to reach out to myself or my colleagues, there'll be a link down below if you want to reach out. Really love to work with y'all. I see patients from all over the world via FaceTime, Zoom, and the phone. All right, so let's dive in. So low progesterone is a major issue today. I'm seeing it in my female patients, even in their late teens and early 20s. So in a woman's hormonal cycle, you have two phases. You have the follicular phase, where the follicle is growing, and that follicle, there's an egg that results from that, or the follicle comes from the egg, and that follicle then stimulates estradiol from the FSH that's made that stimulates the follicle. So first step is we have our follicular phase. We have our brain making FSH. That's follicle stimulating hormone. That's the fertilizer that makes the follicle grow. Follicle grows, the egg comes out, and then we have estrogen that increases from that egg being released. And then where the estrogen increases at that max level around day 11, 12, 13, this is where progesterone starts to rise. And progesterone rises from LH. LH is like the fertilizer that makes the progesterone grow. Where estrogen peaks out and progesterone goes up, this little area is where ovulation happens. This is where you can get pregnant. And then from there, day 15 onward, this is where our luteal phase starts. This is the second half of our cycle where progesterone predominates. And a lot of women, because progesterone is actually a precursor to cortisol, cortisol being a stress hormone, women today, are they more stressed or less stressed? Well, they're definitely more stressed, right? All the craziness in the world, blood sugar swings, inflammatory foods, going on a low-calorie diet, over-exercising with CrossFit, not getting enough sleep, maybe having a chronic gut infection. Now this progesterone that happens in the last half of the cycle, that progesterone is going to go and start being used to make cortisol and stress hormone. And when that progesterone starts to peter out, this is where we may start spotting at the end of our cycle. We may start bleeding more. This is where the PMS window, instead of one day of feeling icky, right? Breast tenderness, cramping, mood issues, back pain, right? Instead of one day of that, maybe now we have 3, 4, 5, 6, 7 days. And it becomes insane. Irritability, depression, all of those issues, partly because one, estrogen starts to fluctuate, progesterone drops out. And when we start having low progesterone, we can almost say low progesterone equals estrogen dominance, okay? Estrogen dominance means there's normally a ratio of about 25-1 progesterone over estrogen. So when progesterone starts to drop and estrogen creeps up, that ratio, this gap here starts to narrow. That is estrogen dominance. And estrogens help cells grow. Progesterone helps cells grow up. All right. So imagine growing, big baby, small baby, big baby, right? Progesterone, small baby, bigger adult, right? Progesterone is differentiation, maturation. So we need a balance of each of those. If we just have estrogen, then we start having endometrial thickening. We can have fibroids, endometriosis. You add in some insulin resistance. Now we have ovarian cysts. We got blood sugar swings. We got inflammation. So you can see how all these hormonal issues can affect mood. They can affect energy. Progesterone is a natural GABA chloride channel opener. So that's going to open up GABA into your brain, and GABA is the brake on your nervous system. So when you are stressed, when you're hitting the gas pedal all day, go, 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 GABA helps you downshift and relax. So progesterone is going to help relax muscle. It's going to open up the GABA. It's going to allow you to sleep better. It provides a reserve for building blocks for cortisol. Again, if you're chronically stressed, though, you'll lower that cortisol. It's when that progesterone starts to low, then you're going to lower, you're also going to have a whole bunch of PMS issues as well. So the first thing we have to do is we have to fix the adrenals. Get your adrenals tested. The more you're whipping a tired horse and stimulating cortisol, you can guarantee you're pulling progesterone to make cortisol. Second, we also want to maybe even give some progesterone. We may give progesterone. We may give specific herbs to help modulate LH, the brain, talking to the ovaries and to the uterus area. We may give some hormones or some herbs to support that feedback loop. We're obviously making diet and lifestyle changes. We're making sure sleep's good, hydration's good. We're making sure inflammation's under control. We're also looking at the gut because so many people don't connect the gut to hormones. I see so many medical doctors, they want to just give a hormone, give a pill, and the person has Giardia or H. pylori. They're not digesting their protein. They're not digesting their fat. Remember, all hormones come from what? What is it? Cholesterol. We need cholesterol. We need essential fatty acids. We need amino acids to build healthy hormones. So we need to make sure we can digest. And if we have poor digestion, we're gonna have a big bottleneck with all those building blocks getting into our bloodstream and being able to make healthy hormones. So very, very important. Look at the adrenals. Get an adrenal test done right during the heart of the luteal phase, right around day 20 of your cycle. If you're not sure when that is, get some OPK test strips, ovulation predictor kit that measures an LH of a surge in LH, and do it 7 days after you have a surge in LH. Get your adrenals tested, get your gut looked at, work with a great functional medicine doctor that will go through all the diet and lifestyle strategies, blood sugar, nutrition, inflammation. You got to have a good checklist and you got to go through everything to make sure it's on track. I'm going to open it up for some questions for y'all. Thanks for being patient. Put your comments down below. And if you have a friend or family member that's dealing with issues that sound like this, that resonate with you, and my style also resonates, please feel free and share this info. Sharing is caring, y'all. All right, let's dive in. All right, I may skip some questions if they don't quite pertain to the topic as much, so let's go. Just had a tooth extraction with bone graft. Don't want to take antibiotics they give me. Is it unnecessary to take them if a person doesn't have an infection or comorbidities? So it depends, right? A lot of dentists are playing CYA because of the fact that a lot of the bacteria could go to the brain or could go to the heart and could cause a problem. So there is that CYA aspect. So there are natural things that you could do. You could gargle with silver, and that would have a more topical effect. So if there is a potential infection, you could hit it that way. There's a nice mouthwash by Young Living called Thieves. So again, I can't tell you to do it or not to do it, but those are some other strategies that are more topical versus dropping a localized bomb. But either way, just talk to your dentist about it and let them know what you're going to do so you guys are on the same page. Okay. Dr. J, kind of continue where I left off yesterday. I meant about 20 to 30% calorie restriction plus a 19-hour intermittent fast and cycling protein. Is this too much? I would make sure there's no calorie restriction. Again, the question is, do you have a lot of symptoms though? Do you have a lot of mood issues or energy issues? I don't recommend any intermittent fasting until blood sugar is good and hormones are good. Once you're stable hormonally, blood sugar-wise, energy-wise, then intermittent fasting is great. Just make sure you're still getting enough nutrition with your diet throughout the day. That's an awesome question. All right, good. Okay, I may skip some questions here. Also been doing keto recently, trying to take out candida and C. diff infections simultaneously. Currently doing some herbal adrenal support and some detox binders, gut precursors, multi. Good. All right, excellent, very good. Let me keep on rolling. Hey, Dr. Richard, how we doing, brother? Good to see you, man. If a period has a horrible cramping, if only for the first day, what could that indicate? Seems to be I have some green shakes a week beforehand. What does that mean? So if we're having cramping on day one, the first easiest thing is get some extra magnesium in your diet, whether it's through green leafy vegetables, whether it's through a supplement. Magnesium helps relax muscles. You can also do some ginger tea. That's wonderful. Make sure your blood sugar is stabilized. If you're bleeding a lot, you can always take some or just eat some extra high quality red meat, maybe even some liver glandular support. And you can even do a special herb called cramp bark, which really helps relax the muscles. But again, some of these things are going to be patchwork. So you really want to work with a functional medicine doctor if these issues are more chronic. Okay, if they're more chronic, make sure you reach a good functional medicine doc. I bleed for 4 days, don't bleed for a day, then bleed for one more day consistently. What does that mean? So there's probably some hormonal imbalances. When I run a month-long cycle, sometimes we'll see estrogen go like this. It just kind of goes up and down. And so there's different protocols that we'll do to kind of keep estrogen a little bit smoother. But you probably need to just work on your hormones overall. So typically, when you get the cycle as a whole healthier, just things naturally tend to smooth out, and you see less bleeding. And it's usually no more than 4 to 7 days of bleeding, and usually spotting happens after, not before. And then again, when you're looking at your menstrual flow, you want a brighter, redder blood flow that's coming out. Browner, darker blood means you did not shed your uterine lining the previous month. That means the blood that's been sitting up in your uterus has been oxidizing, not good. So you got to flush that out. So every month, your period essentially is your uterine lining taking a shower, and it's like you're only got your half clean, and you walked out of the shower with the other half dirty. So that's what happens if you don't have a complete menstrual flow. And so when you look and see that brown oxidized blood, that means you didn't have a really good shedding of the last month's cycle. Okay, very good. What was the mouthwash? Young Living is the mouthwash, or Young Living is the brand, and the product name is Thieves. That's a really good one, Thieves. What do you recommend for C. diff, now called Flagyl or Okay, so for C. diff, it just depends. Most people have other issues besides C. diff, but we'll use Sac Boulardii, we'll use higher dose berberines, we'll use silver, we'll use ginger. But I want to really highlight, you want to make sure other infections that could be there are addressed. You want to make sure all the other things that could lead to that immunocompromised condition where you get C. diff, you want to make sure all those things are being addressed as well. Dennis writes in, can antiperspirants increase estrogen in men? It depends. It depends. I mean, I use the deodorant brand called Native OS. It's phenomenal. I like their aloe. Is it aloe and mint or aloe and cedar? And they have a citrus musk that's really good, but their products are great. They're all grain-free, really high quality, simple, clean. Love it. Okay, excellent. I have chronic burping 24/7, even when not eating, excessive burping and consistent brain fog. What could that be? H. pylori or indigestion. So first things first, gas out the mouth, burping, right? That's indigestion in the stomach. Gas out the rectum, flatulence, right? That's typically going to be caused through fermentation of bacteria, small intestine, more the gut side. And obviously, the more it stinks, that's methane bacteria. So you kind of know there's more methane dominant SIBO when you have smelly gas. Just gas in itself, that could be hydrogen gas. And again, infections and fungus can do all this stuff too. So with stomach indigestion, just work on chewing your food well. Make sure it's a high quality, anti-inflammatory, nutrient dense food, not a lot of excess sugar. Increase stomach acid, increase enzymes, chew your food up well. Don't drink a lot of water when you eat. Drink 10 minutes before, 2 hours after. Again, you could have some bacterial overgrowth. You could have some H. pylori. All those are possibilities. Would you suggest the female to do a Dutch Complete or the adrenal test to start with regulating hormones? Do the Dutch Complete, which includes the adrenal test. Dutch Complete is the adrenals plus female hormones. The adrenal is just the adrenal. You would do it right at the heart of your luteal phase. So if you have about a 26 to 30 day cycle, right around day 20 is adequate. If you're on the fence, just do a ovulation predictor test and then do 7 days later and complete the test. And if you guys want to get that test through me, you can go to justinhealth.com/shop, click on lab test, and then you'll see Dutch Complete. I'll also put the link underneath below in a minute once we exit this video, and I'll put it there for easy access, y'all. Can you overdose on ginger? I juice it and drink it at least a half a cup every day. I'm fine with that as long as you don't feel like you're having an issue or a problem with it. Ginger is one of those things that you can consume chronically. I have no problem with it. A lot of health benefits. It lowers blood pressure. It's highly anti-inflammatory. It prevents platelet aggregation, meaning it makes your cells less sticky. Really, really good stuff. You said silver, deodorant, glutathione, and what? Can you say specific products? So what was the context for? Give me the context of that. Need a little more context on that. I'm going to go to Facebook. I said a lot of those things, but for different questions. If you didn't catch it, you can always just rewind the video afterwards. Okay, I'm on Facebook here too, y'all. What do we got for questions? Okay, I was getting extreme migraines during my period. Started taking natural progesterone cream. Headaches went away. That's good. Problem with progesterone cream, if you're a female, is progesterone cream does not flush out of your system that fast. What does that mean? So you can be on day 1, 2, 3, 4 your cycle, and you could still have some cream left over from the previous cycle still in your skin. So I don't love using cream progesterone on my cycling women. You could do it more if you're menopausal because your cycle's a flat line. There is no more cycle, right? The eggs and the follicles are gone, so you kind of have a flat rhythm where you can get away with it. But I still see my menopausal women still have super high levels because it just super saturates over time. It's like using the same sponge to clean up a table and you never wring out the sponge. And then over time, it just gets more and more saturated with whatever else it's absorbing. My doc wanted me to give me oral progesterone for better absorption, but I haven't switched yet. Headaches came back. And when I forgot to apply the cream mid-cycle, do you think oral progesterone? Yeah, oral is definitely better. I have a product I formulated called Cycle Balance that is oral progesterone. I like it orally because I can dose it way better. With creams, it's like you know, 1 finger, 2 fingers, or you get the clicks. You don't get a really good even dosage on the progesterone creams. Hey Sherry, how you doing? Want to do a general detox? Which supplement of yours should I order? So in my line, if you want a good general detox, I recommend the Detox Aminos, which is great. That's going to have calcium deglucarate, so it'll help bind up any extra estrogens or mold that's hanging out. It also has all of the sulfur amino acids, methionine, cysteine, taurine, glycine, glutamine. We get all those amino acids. We extract them from human hair because human hair is actually very sulfur rich. And then those amino acids are going to help run those phase 2 pathways better. And then for phase 1, Sherry, you could do Antioxidant Supreme, which would have a lot of the extra B vitamins and antioxidants to run phase 1. Phase 1 is fat to water soluble, toxins in the fat to water. Phase 2 is water to excretion. You can always throw in some extra binders there to kind of, right, pushing is these phase 1 and phase 2. The catching would be the binders. So that could be helpful for you, Sherry. Antioxidant Supreme, Detox Aminos. How do you test adrenals? Great question, Martha. There's a test I use called the Dutch Adrenal or the Dutch Complete that works phenomenal. It's a urine test, and it really does an amazing job looking at free cortisol, total cortisol, cortisol rhythm, as well as all the female and male hormones. Hey, Ashley, how you doing? What are your thoughts on taking nitric oxide for hormonal heart palpitations when estrogen drops? So a lot of heart palpitations could be from progesterone because progesterone is a GABA chloride channel opener. Also, when you have heart palpitations, look at potassium and look at magnesium and look at blood sugar. Make sure your blood sugar is not fluctuating. Make sure you're getting enough protein and fat. And then look at your potassium, look at your magnesium, and look at your progesterone. How common is the cost on the liver? So cost for liver, you mean like liver glandulars? Liver glandulars are pretty cheap, usually around $30 for a good sized bottle. My Liver Supreme support's probably around the same as well. Oh, how common is the cost on liver cyst? Oh, the cause you mean. I think you mean cause, right? I mean, anytime you have a cyst, it's caused by inflammation, right? So liver cyst, I would look at high amounts of fructose. High amounts of fructose put stress on the liver. I'd also look at gluten and inflammation in the gut. One thing I remember from Dr. Zach Bush taught me to stabilize my blood sugar, and he said that this stabilizes the hormones. Sounds simple, but how do you apply that info? Low carbs, so no spikes. Great question. So yeah, when we have progesterone issues, blood sugar swings can easily affect your hormones. How? Well, when you eat a bolus of carbohydrate, what goes up must come down. So the higher and faster your carbohydrates come in, the more that converts to glucose. The more glucose you have, the more your pancreas overproduces insulin, which drops that blood sugar even lower. And when that blood sugar drops lower, then your adrenal come out with cortisol and adrenaline to bring it back up, which makes you jittery and anxious. And then your body is going to, that blood sugar drops, it may use more of that progesterone to make cortisol to bring the blood sugar back up. So these ebb and flows are going to stimulate the adrenals, the medulla, which is going to be adrenaline. It'll stimulate the adrenal cortex, which is going to be cortisol. And then on the high side, it's going to stimulate insulin. So you get this insulin, adrenaline, cortisol. Then that cortisol may come from progesterone, and that progesterone may start to get lower because of this blood sugar roller coaster. So we have reactive hypoglycemia, too much carbs, it goes like this. And then we have just straight up hypoglycemia, which could happen if you're going too long without eating, fasting, those kind of things. All right, guys, I got so many questions today, I can't even answer them all. Sheesh, man. Okay, let me answer one more question for y'all, and then I'll probably come back maybe tomorrow morning. I'll come back tomorrow morning for you guys, all right? I'll come back. I'm here for you. All right, friend constantly coughing, 4 weeks, really bad. Liquid went down, wrong pipe. Doing ginger, NAC, nebulizer, glutathione, nasal rinse, but what could this be? Anything else? Really tough to say. Anytime I see weird stuff, I always want to look at the gut, make sure there's no infections, make sure digestion is good. Best thing for allergies and headache due to allergies. Watch my nasal flush video. That's a huge one. Have a really good autoimmune paleo template. Look at natural histamine degranulators like that are in my Allerclear product. Stinging nettle, quercetin, bromelain, NAC. Those are all great. And of course, make sure you're digesting your food. enough stomach acid, HCl enzymes. Dr. J, I have blood sugar issues. Waking blood sugar 77, before breakfast 69, 1 hour after 80, then another after hour 98, and then 101, 86, boom. That's not bad. I mean, so 1 hour is 80, 2 hours is 98, and then 3 hours is 101. That's not bad. I mean, that's still relatively fine. I mean, are you getting jittery? Are you getting shaky in the 70s or at the 69 level? I'm not too worried about that. But again, those numbers I'd want to see in context of kind of what does your symptom profile look like, and I'd want to know where your adrenals are at. Do you have any other pre-existing conditions, thyroid, adrenal, blood sugar stuff? It's hard to know just from that one question what's going on. Okay, let me go for one more question here. I started a raw beet, lemon, ginger, green apple smoothie to raise hemoglobin and improve anemia. After a few months, it caused numb limbs, stiffness in all muscles, and that hormone related. I have normal progesterone but higher estrogen on a Dutch test. So number one, you're not going to really increase hemoglobin by doing that, okay? Because the plant-based iron support is non-heme. It doesn't really touch ferritin. It doesn't really touch hemoglobin. You need animal-based heme to really increase iron levels. I wouldn't be surprised maybe you just got a lot of oxalates from that could have been a problem. It's hard to say. I need a little more clinical context of what's going on, but I would be looking at, if you want to increase hemoglobin, I'd be eating some high-quality red meat, maybe some iron chelates. Iron chelate's great, or some liver, high-quality liver. That's going to give you the kind of iron you need to improve hemoglobin, hematocrit, and your red blood cells, right? How do you know you have anemia? Low red blood cells, low hematocrit, low hemoglobin. You can double-check with ferritin. You can double-check with iron saturation. You can look for high-binding proteins. You can also look on your MCH, MCHC, MCV, high MCH, high MCHC, high MCV. That's going to be more iron-based, B12, B6, B folate-based anemia. Lower, that will also confirm with an iron-based anemia. You may not have all of those together. So when I go to these things, I have my differential checklist where I want to check all of those things off. It's really important. Okay. All right, guys, I got a patient I got to run to. It was phenomenal chatting with you guys. Dive in deeper. Put your comments below. If you want to reach out to me, click below, schedule a consult. Love to work with you guys. I'll be back tomorrow for you, I promise. All right, guys, have a phenomenal day. Take care, y'all. Bye.